a diabetes, for diabetes, it would be 6.5 or above would be your A1C levels. And then I think Chloe was going to talk about the cause of each.
Yeah, so if you have too little sugar in the blood, you of course will get hypoglycemic, and some causes of that would be skipping or delaying a meal, eating too little food, extra exercise without taking your insulin. And then the symptoms of it would be you'll be shaky, sweaty, you'll have a rapid heartbeat, dizzy, hungry, headache, and weakness and fatigue. And sorry. What you can do to manage that, you can, I think we said it earlier, you can drink a half a Coke, peppermints, no chocolate, and yeah.
Y'all are on A1C numbers, right? So pretty much the cause of that is if you got diabetes, right? Or if the last few months you haven't been exercising, increasing your sugar intake, right? Not watching what you eat. So unhealthy diet kind of thing can cause that.
Yeah, basically same thing.
It is very
unhealthy diet with causes it. Right. So,
It's a precursor to diabetes.
Right. Kind of flick in. So they used to call it borderline diabetes, and now they're calling it like pre-diabetes. I think the true term for it is. So, oh my gosh, my computer's about to go totally dead. So what are we going to do with those patients? Is that going to change anything in the way you exercise those patients, or what else might you add into and just besides exercise, what else might you add into that conversation with the patients about some things that you might need to know?
diet. I mean, how checking their blood sugar is important before the start of therapy.
Yeah.
Their diet.
What they're eating.
Y'all can still have that conversation. You know that exercise and diet are two things that can bring that down. So that's really your main focus of that. You can bring in that patient education a lot on there.
Along with like patient education, I know for myself, sometimes you hear like just an experience or a story of somebody who was pre-diabetic and followed the education guidelines that you gave them to reverse it and like to actually start living a healthier lifestyle. Just instead of just sending numbers at them, give them a story, like a testimony, basically.
Yeah.
It may help with the motivation factor to get them on board with your treatment plan and like, oh, okay, well, this stuff actually works.
Right. And if you can explain to them that that number is not just like the week before you take the test, what you did, but the actual like 2 to 3 months, that's a view of 2 to 3 months. So your glucose level when you prick your finger is like that moment in time versus the A1C is of a 3-month type thing typically. So if you can let them understand and buy them into like, give me 3 months of this type of exercise, give them a plan, and of your eating, make them have an eating diary and your exercise diary so that they're tracking it, and it is guaranteed to see a change in that number. So get them to just say, yep, for 3 months I'm gonna do this right. You can get that change, and they will understand how important and how that fix is truly from foods and exercise. So that. Okay, yeah.
Stuff on the PT INR too. So some things said the PT prothrombin time test and the INR international normalized ratio is the same thing, and it kind of is. The prothrombin time measures the time it takes for the liquid portion of your blood to clot, and it's usually 10 to 14 seconds. And then the INR test just like make sure that all of the lab results that different labs are getting are the same. So it's not like different if you go to one lab than the other lab. So it's kind of the same thing, but not really. The time for PT, if it's greater than 25, you need to have guarded treatment because they're at a really high risk for bleeding. And then I found this on the APTA. If they're on Coumadin, which is a blood thinner, the PT or INR test greater than 3, you can't exercise at all because they're at risk for bleeding. So the maximum number is 3 that I found.
Yeah, I want to say that one of the facilities I was at before, like if PTINR came back like 2.5 or greater, that was an immediate bring that message to the doctor, and you didn't touch them. So that's going to be one of those probably critical values you need to determine. I don't think I found that one in your PTA exam book, that critical value, but just I would know 2.5, 3. That's going to be a critical value for you, probably for you.
Yeah, that was on it was like a chart from the APTA that I found that one, but I couldn't find it in the board book either.
Perfect. Okay. Anything else y'all wanted to talk about before that group? Sorry. I'm writing y'all's names, sorry.
We thought of some of the reasons why people might be on like blood thinners, like Coumadin and heparin might be one, and was it Warfarin?
Warfarin?
Yeah, like just having strokes and like embolisms, DVTs, just to be aware of the patient presentation from those complications. And I forgot how we related it to INR. What did we say, Morgan?
Or
Miss Jill asked a question about strokes. I'm having trouble remembering, but it was about patient presentation.
well, we have like other reasons that you would do a PT test. It would be like liver function and then like bruising. Ms. Jill was talking about bruising a lot. Like if your patient's in a bed for like not a month, but like a week, and they're not really doing anything, and you see abnormal bruising, you can maybe bring it up to the doctor or the nurse and say, hey, I think we should do this test to figure out what's going on because they haven't been moving to bump themselves.
Right.
Mm-hmm.
Definitely bringing that up. Hey, this patient's been bedbound for however many days. I noticed there's not a PTINR in there. Is that on the list of tests that they're getting anytime soon? I'm worried about this bleed, their bruising, easy to bring that up for sure. Good. Yeah, good. So anything else before I cut y'all off? Okay. There is a huge 42-page packet that's from the Academy of Acute Care Physical Therapy that should be up by now, or maybe it's coming up at noon, I think, that has excellent graphs and charts on all these numbers and breaks it down. Really, I derive what I came up with from this graph to oh, this is really good. I also pulled up from the new patho book that we have, so I know somewhere's in it that y'all have it in your old patho book. I don't know exactly which pages or whatnot, but there I would suggest that y'all take this because trying to listen in, write down people what they're talking about, and it's so easily to say, oh wait, I think they said the wrong one. It's very easy to miss something. So I would suggest taking this graph that y'all all worked on, and y'all can keep adding to it, and then maybe taking the information from the thing that I posted and recreating your own, or adding to that Google one so y'all can all share it, to have discussion on it, and just to kind of have that there for y'all as a reference guide. Because again, you'll have to know PTINR, if they're telling you it's a 2, oh, what do I do? Can I work with them or not? Because that would be important. So I knew today would kind of be probably a more boring day than a case study. But I hope that this did help you to think about stuff oh wait, I don't know about that. I need to look that up. I hope that's what that pointed out to you. Again, it's hard to remember all those numbers, but if you can do that whole process of thinking back, okay, so what does red blood cells, what does that actually do? If that's really high, now go down the line. And if it's really low, now go down the line of that. So that's why I kind of put it in that order. So hopefully your brain was thinking that way. So, oops, man. I wanted to put y'all in groups again and like run through these and just try to make it fun and go through the questions and, you know, like, hey, see which group wins. But apparently when I put you in the groups, y'all can't all see my messages. So we're just going to go with this like we just did. I have a couple more questions we'll go through to kind of get your mind going. Raise your hand if, has anyone taken the first board exam practice test? Okay. And were you able to sort of see where you need to work on, like what you need to work on, and kind of, is it knowledge based or am I reading the questions incorrectly, that kind of thing? Okay, and that's what I'm hoping some of these questions will kind of get you going and get you thinking. All right, so which portion of the brain becomes overactive in PTSD? A, hippocampus, B, amygdala, C, thalamus, and D, cerebellum.
Say B.
Would it be amygdala or something?
Yeah, I'm thinking amygdala.
Yeah.
Excellent. So why do y'all think amygdala?
Amygdala.
Why do you tell us?
It's
Because
the
it's
emotion part of your brain.
it's responsible for
primer.
forming the memories and association with an emotion.
And I
You know,
feel like I remember something about having to do with fear.
Fear and behavior, maybe.
Yeah.
Like the
and plus I
primitive-
studied that yesterday, so.
The amygdala and limbic is primitive and fear-based.
Mhm.
Yeah.
Good job, y'all. Good. This is what I want y'all to like talk it through. Good. All right. So I just thought this one was interesting. Veterans of the Vietnam War are predisposed to which two diseases secondary to exposure to dioxin in the herbicide mixture Agent Orange? So this is just knowing what does that cause. So atherosclerosis and diabetes is A. B is diabetes and chronic lymphocytic leukemia. C is myasthenia gravis and atherosclerosis. And D is myasthenia gravis and chronic lymphocytic leukemia.
Would you mind saying the start of the question again?
Yep. So veterans of the Vietnam War are predisposed to which two diseases secondary to exposure to dioxin in the herbicide mixture Agent Orange? So you would have to know what dioxin does to your body. So,
What was the choices again?
okay, atherosclerosis and diabetes, diabetes and chronic lymphocytic leukemia, myasthenia gravis and atherosclerosis, and myasthenia gravis and chronic lymphocytic leukemia.
I'm gonna go with D.
I'm gonna
Go
go
with
with D.
A,
C.
the AL and diabetes.
Chuck's not here.
It's something with the leukocyte.
I just guessed.
It's definitely white blood cells.
White blood cells, so y'all know it's either C or D, right? Because that's the leukemia one. So then would you think diabetes or myasthenia gravis?
Probably myasthenia
Diabetes.
Gravis.
Shucks, I'm hearing both, but it's diabetes.
Is it?
I had to like try to look up like in that one. I was not sure what dioxin did, and so I think the reason why I put this book was because they do talk a lot about the generational and stages and how to communicate, and the traditionalists versus your baby boomers and such. So and their mindsets and how to motivate those different generations. And then so I thought, well, that might be a good question to bring in because you may need to like be comfortable with or know some of those things. I'm not sure, but I just throwing it out there for y'all.
What was the answer?
It was diabetes and chronic lymphocytic leukemia. All righty. And then which of the following heat illnesses requires referral to a physician? Heat syncope, heat cramps, heat stroke, heat exhaustion.
Heat stroke.
Stroke.
Yeah.
Yeah. Heat stroke, right? I would do. Heat cramps, not a big deal, right?
Yeah.
heat syncope, if you can drink water, rest, and it modify itself, you're okay, right? But heat stroke is definitely something that you would have to need to go see a doctor, a physician for. All right, which of the which of the following structures is not well developed in infants and puts them at greater risk for developing central nervous system complications from environmental contaminants? Surfactant in the lungs, the blood-brain barrier, epiphyseal plates, or neural tube?
Neural tube.
Neural tube.
Can you say the question again?
Which of the following structures is not well developed in infants and puts them at risk for developing central nervous system complications from environmental contaminants?
Neural tube.
So surfactant in the lungs, blood-brain barrier, epiphyseal plates, and neural tube.
Wouldn't it be A?
Yeah, isn't it an
Yeah,
infant?
the surfactant maybe.
Surfactant, huh?
Breathing it in.
Because
Surfactants is with like inside, like when they're still in the womb, they're born too early, then they don't produce enough surfactants, so then they'll have breathing problems, right?
That doesn't affect the central nervous system, does it?
Right. So think about your question, what it's asking. It's not well developed in infants.
Blood-brain barrier.
And then risk for central nervous, complications from environmental contaminants.
Blood-brain barrier.
Now y'all are thinking on it. You have to think back on, like initially when you hear, oh, not well developed, you think the lungs, the surfactant, and there's not enough surfactant, right? That's what hits you first. But you got to look at that question and break that question down into what it is. So my train thought, I saw CNS and I thought, okay, blood-brain barrier and then neural tube, because that has to do with central nervous, right? But then when they tell you complications from environmental contaminants, well, what is preventing the brain from and environmental contaminants from crossing over? That's that blood-brain barrier, which directly affects the central nervous system, right? So that's how you think on that one. All right, let's maybe do one more. Deficiency of which of the following vitamins will lead to pernicious to anemia? Vitamin A, B, or D?
B.
B.
B is in boy. Good. Okay, this one you might be able to remember from just now. Malabsorption of which of the following vitamins will lead to easy bleeding or bruising? Vitamin A, B, or K?
Okay.
Okay.
A.
Okay.
Okay. All right. And which type of hernia occurs when a sac formed from, hello April, put your glasses on, from the peritoneum and containing a portion of the intestine pushes through the abdominal wall? Would it be a
Inguinal?
Hiatal.
Yeah, hiatal hernia.
Hiatal.
So the options were sports hernia, which I don't even like something. Hernia, that clearly isn't in an umbilical hernia, or direct inguinal hernia. I said it, so. Okay. All right, so that was a couple other questions there. I just try to pull up and get y'all thinking. I hope, I know this could probably be a little bit boring going through lab values, but I was really wanting y'all to feel that, okay, understand what this is, what do red blood cells, or what does potassium do for my body, then how would that affect the rest? So just breaking down how you think about things, because remember, I know a lot of your feedback from y'all's score builders class was, man, I didn't think of my questions that way. And so breaking down those questions, you know, really seeing what they're trying to get at. All right, so excellent job to do. And let me see if there's any announcements. Still have not gotten contact with score builders. We're waiting on the check to be able to pick up and send it so we can actually schedule that. Peeler, so that you don't have to graduate Okay, so if we don't finish the peeler, that's the last thing we need for PTAP 2735. So if we can get that in, I can grade those, and well, Marty and I can grade those, and that class won't have to have an I. But you would still have your I in 2750 because we haven't completed the clinical portion. So if y'all would like to do that, we can kind of talk about a day that could work for that. If y'all are in yes for that. How about this? If you do not want to do that and you want to wait till after you finish your clinical and turn in peeler, private message me on here right now, okay? All right.